You've probably heard of D.I.D, and you've probably seen these movies. Split, Primal Fear, Fight Club, Identity, and Glass. These are just some of the movies that have represented people who have D.I.D. Well, some of them are correct, and then there is Identity, Glass, and Split. Those don't show how people who have D.I.D are really like. They aren't really that mean. They aren't there to kidnap you like Split shows. You're probably questioning, what is D.I.D? Well, D.I.D is dissociative identity disorder. This is where a person who has two or more alters. According to mycleveland.org, D.I.D happens between the ages of 5 and 10, 9 being the age where your personalities combine into one. These are what normal people are, having one personality. But people who have D.I.D have more. They have their own personalities, histories, traits, dislikes and likes, and what they look like. They don't look like the person on the outside. D.I.D is caused from mental, sexual, physical, or verbal abuse that, like I said, happens between the ages of 5 and 10. I find this extremely wrong, but it happens. Now you're probably questioning, what is an alter? Well, alters are, as I said before, they have their own personalities, looks, gender, age, and even what they like to do. According to traumadissociation.com, there's multiple different alters. To just list a few, there's caretakers. They take care of the body inside and out. They also take care of the alters inside. There's littles. They're from the ages of 0 to teenagers. 0 being not being able to speak at all, and teenagers being able to understand adult language. There's also gatekeepers who keep the traumatized alters that hold all the trauma from when they were 5 to 10 away from the rest of the alters. There's also dead alters who are formed from near-death experiences. There's also the protectors. They are ones that keep the body safe. They make sure that the body isn't hurt physically or mentally. They are able to manage anger, fear, rage, any of the emotions that you have now. There's now, and finally, the host. The host is the person or alter who is out the most of the time. They are usually the ones you normally talk to. You're now probably wondering, who founded this? Where was it? And when? Well, a doctor by the name of John Martin Chevalt, a physician at a hospital in Paris. He founded this in the early to late 1880s. It was called epilepsy. That's the last part I remember. It was first known after he named it. It was later changed to multiple personality disorder, and then changed to what we know it as today, D.I.D. Now that you know the information that I've told you, you can go out and meet somebody that has D.I.D, or you can learn about the person who has D.I.D that you're friends with that never told you. Um, Before I end this, I would like to say don't ever trigger somebody who has DID so you can talk to another alter that you really like. It is wrong and it's cruel. And don't do it for laughs and jokes. It's not right. It physically stresses out the body and their alters. If you meet an alter or a person who has DID, introduce yourself. Tell them your name. Tell them your age. Be nice to them. They're probably scared to tell you that they have DID. And the alters who that try to push you away aren't there really to hurt you. It's so they can hurt the body because they don't know anything else besides hurt and pain. Thank you a lot for learning about DID.